All right, so question 5 now. Question 5. If you could change one thing about how diabetes is supported globally, what would you hope to see? I think kind of tying into a lot of things that I've said so far, I think it's that kind of putting people on the same level. It's really hard to hear, not just globally, but even the difference between states in my own country or states in other countries have different rules, regulations, pricing. It would be nice to see just a global thing, like for every type 1 diabetic or type 2 diabetic, gestational diabetes, 1.5 people are still being diagnosed, that if there was free options, like here's free sensors for everyone. If your meter breaks, here's a free meter. Like, I remember when I first became diabetic, I had to pay for needles, whereas people that had addictions to certain things, they got them for free through the healthcare system. So someone that literally needs it to survive had to pay money for it. Whereas if I just went in and said, I'm addicted to X, Y, or Z, I could get a free needle. Like, how is that fair? So I think globally it would be nice to have things on the same playing field. Everyone on the kind of the same level with what is available to them and what in both medication and in knowledge, I think is very important. All right, question 6 now. What is something you think is done quite well in regards to supporting diabetes and people managing diabetes? I think although people complain about things like, for example, the blood glucose sensors not always working or that, I think we've become just the technology is so amazing. Like, we've gone leaps and bounds with technology for diabetes in general, whether it be any of the types, just our knowledge and things available, changing from using syringes that we had to suck the actual insulin out, measure it out, get the air bubble out, to now these pens that we can just dial in, even pens now that come with different levels of dialing for different people to manage their diabetes, and just bang, it's amazing, I think, where technology has brought us. And I think sometimes people forget that. They forget where we've come from. And I think that it's just been done really well, the way that we're rolling out new research and new technology. And I know Australia, for example, is one of the leading countries in, if not the leading country, in research for things like type 1 diabetes and that. So it's really a privilege to be in a country where all of this technology, all this information, all of these teams of researchers and technicians and engineers and computer programmers and all this are making every day more ways to make my condition more manageable. All right, so question 7 now. Question 7. If you could redefine diabetes to your younger self, how would you do so? I think when I first got diagnosed with diabetes, the biggest, most important thing to me was, can I eat my sweet Chinese, like sweet and sour pork and honey beef and my lollies and that? I think that was the biggest thing on my head at the time. And I think redefining now what I know versus what I kind of got told then, I think I would tell myself that managing diabetes is less about the meals. Because when I first had it, it was okay, a shot with meal, a shot, each time, breakfast, lunch, dinner, and then a manageable, curve for the day shot. It was at night, I think, at the time when I took it. And I think it's, especially now with technology that I can just scan all the times and see my patterns, I think it would have been one of those things I would have told my younger self, just do a test. Just do a test and try maintain that steady line. Don't think about it like meals are when you take your needles. Just focus more on keeping a steady line. And obviously it can be overwhelming thinking, it's so much easier to tap a phone versus a finger prick. But I think just that push for keeping those levels more balanced and not trying to think of it as this is a needle for dinner, as such as just maintain the level, adjust accordingly. I think like self-injections and a sliding scale, I would have loved that information more when I was younger. Final question, number 8. Do you have any advice or tips for people wanting to educate and navigate around improving their access to diabetes resources? I think one of the biggest things that's made my life with type 1 diabetes much better would be, funnily enough, accessorizing. Finding out what is available on the market to make my life easier. I didn't know until more recent years all of these kind of things that you can do to make your life better. Things like compression gloves for circulation. Things like diabetic copper socks with wide tops that are better for your ankles. I got glucose tablets. I wish I'd known about them my whole life, but glucose tablets over jelly beans. So I'm just not snacking on jelly beans. I don't want to snack on a glucose tablet. So like it gets away the cravings to just snack on things. Like obviously the sensors are something that's been more over the years than that, but there have been things out there for people with diabetes that just make life better. And I think it's that educating and informing people, spending a little bit more time to let them know, oh, did you know, by the way, you can do this? Or did you know if you go on this website, you can subsidize the price of something? Just knowing that things are available make me go, I'd probably do that. I mean, for example, currently I don't have a pump. And I recently got a healthcare program that I found out if I was paying like $10 more, I don't think it's even a week. I think it's like $5 more a week. I could have a free insulin pump. I'm like, if I had known about that ages ago, I probably would have done that. So now I'm on the list and I'm waiting out to see when I can get that. So I think spreading that information and that knowledge for people to be able to better their lives, it's important that they know about it, but also as an educator or as someone trying to make more awareness of that, I think it's important that you keep up to date too with all of these things that are available so you can let people know about it to make their lives better too. All right, well, that's it from me today. I'm going to head back to my channel, Life's Tough Questions. But in the spirit of that, I ask you, would you rather sit around and do nothing and not take the right attitude, or make the right attitude, make a change, make a difference in both your lives and the people around you too? The choice is yours. I'm Rohan, also known as Australia Guy from Life's Tough Questions, and I don't have a clever sign-off.